Deaths related to alcohol consumption are rapidly rising across the U.S., especially among women. While drinking is still killing more men than women, the rate of alcohol-related deaths is rising faster among women. This is according to the CDC. So Dr. Michael Weaver, he's a professor and addiction specialist with UT Health Houston, is here to talk to us about this report. So first, just a little bit about the data. We started hearing about rates and women drinking more and rates of alcohol deaths sort of during the pandemic. But tell us what you found in this study.
So the study looked at rates of increase in drinking amongst men and women, and what they found is that the rates of drinking in women actually increased more than men for the first time in a long time, although the rates have been catching up between women and men for many years now. But this is particularly dangerous for women because it doesn't take as much alcohol for women to have the kinds of long-term health problems that men do.
And so what are some of the effects of alcohol on the body with women, with both men and women drinking more, but women drinking? So, I mean, like, people think I come home after work, I have a drink, or maybe I have a drink while I'm making dinner. If you do that every night, what are some effects on your body?
Certainly. Well, those drinks can start to add up, especially if you're making a double cocktail and things like that. And so the kinds of effects that it can have are any kind of system of the body. The liver we tend to think of a lot, and you can end up with cirrhosis after years of drinking. You can also have problems with the pancreas. It's one of our digestive organs, and it can start to digest our own body, and that can be very painful. It can even lead to brain damage or other nerve damage similar to what we see with diabetes.
And we've done things on, had reports on dementia and sort of early onset of alcohol sort of playing a role in that even.
Oh, alcohol is hard on the brain, and years of bathing the brain in alcohol will definitely lead to early dementia. And we can see on CAT scans and MRIs that the brain actually shrinks under the influence of alcohol over years of drinking.
Oh, wow. Talk a little bit about what a functional alcoholic is. I mean, people maybe have heard that term, but you know, maybe for people who might not think they have a problem, and then they hear, what is a functional alcoholic?
Well, a functional alcoholic is more of an urban myth.
Okay.
It's just someone who hasn't recognized what the consequences are, or they haven't caught up to them to the extent that other people recognize what's going on. But if you're drinking more than would be good for you, if you're drinking to deal with emotions, if you're drinking just to deal with life stress, then those are signs that it's become more of a coping mechanism, but not a good coping mechanism. And then that's what leads to problems with people's physical health as well as their mental health.
Right. And it just sort of became a little bit difficult for people to define, or they weren't thinking about that. I think, at least thinking back to the pandemic, when people were home more often, you know, home with their families, thinking, oh my gosh, I'm so stressed out, it's fine, I'm going to have a drink while I make dinner, I'm going to have a drink while I do this. And then you realize, oh my gosh, I was talking to somebody at the ME's office when all this was going on, and what they were seeing at the medical examiner's office with people dying from overconsumption of alcohol.
Absolutely. There's not necessarily an absolute safe level, but we have years of studies looking at what is likely to be less dangerous for people that don't have a lot of other health conditions. So for men, no more than 2 drinks in one day, but you can't save them all up for the weekend. Right. So no more than 14 drinks in a week. For women, it's actually half that.
Wow.
So no more than 1 drink a day, no more than 7 drinks in a week, no more than 3 on any one occasion. More than that is what leads to problems.
All right, that is all very good information. So if somebody's listening to this, seeing this, and they want to know where they might be able to go to get help or to get more information, where should they go?
So the good news is there's certainly help available from a whole variety of places. If you have a primary care physician, talk to that person. Let your doctor know, or your nurse practitioner, that you're concerned about this, or just ask questions. Another good resource is priest, minister, rabbi. A lot of clergy are trained in how to recognize this in their parishioners and resources that they can make available. If you have a counselor, a therapist, anything like that, there are lots of people to talk to. If you're in school, school guidance counselors can also help people to get in touch with resources and additional information for students and for parents.
All right, Dr. Weaver, very good information. Thank you for coming in this morning. We also want to tell people there's a free alcohol addiction helpline here in Texas, and that number we're putting up right there on your screen.